Hello, and thank you for joining this live, interactive coronavirus telephone town hall. My name is Dirk, and I'll be moderating today's call with Congressman Jim Costa. As I mentioned, this event is an interactive forum, and we would love to hear questions from you about this developing situation. We'll be taking as many questions as we possibly can live during this event. If you have a question, you can press *3 on your telephone keypad, and you'll be placed in line to speak with a member of our staff. They will take down your name and where you're calling from. The next time you hear your name, you'll be live on the call and able to ask your question directly. Again, if you have a question you want to ask at any time during the call, please press *3 on your telephone keypad to enter the question queue. If you need help from our district office, please go to our website at costa.house.gov/COVID-19-help to submit a request, and one of our caseworkers will be in touch. Again, that's costa.house.gov/COVID-19-help. Now, without further ado, I'd like to introduce your congressman from California's 16th Congressional District, Jim Costa. Representative, the floor is yours, sir.
Thank you, Derek. And I want to thank all of those constituents today from the 16th Congressional District who have been able to come on the line for this telephonic town hall. Clearly, our purpose, our primary focus is to deal with the ongoing health crisis facing America, this pandemic that is impacting every American's health and safety, and the social and the economic impacts are unparalleled. And so our conversation today is going to be about COVID-19 health crisis, what we've been trying to do in Washington, D.C. as your representative. And we have two experts who have joined me to try to answer questions that may be in their area of experience and expertise. We're in a new world today, obviously, with the federal guidelines requiring us to maintain separation and to try to prevent the spread of this incredible, voracious virus that is spreading in parts of this country like wildfire. And so our office, your office, we are still working as we do normally, but we're having to use technology that allows us to take your phone calls and your emails for not only this current crisis facing America, but also the normal issues that we'd be working with you on Veterans Affairs and Medicare and Medicaid and issues dealing with other challenges, visa requests and such. But it is a new world. So let me first say that we are joined by Dr. Vohra, Interim Health Officer from Fresno County Department of Public Health, and he will speak in a moment. We also are joined by Dr. Rebecca Nanyonjo, the Director of Public Health in Merced County. And the three of us will try our best to answer any questions you may have and about the coronavirus and how we are trying to address this both on the short term and the long term. And let me explain. Obviously, the Congress with the President have passed three pieces of overwhelmingly bipartisan legislation in the last month to deal with this crisis. On March 4th, we passed the first bill to respond to the coronavirus outbreak. It was signed into law 2 days later by the President, provided $8.2 billion in emergency funds to deal with the immediate impacts of the crisis. $3.4 billion was for countermeasures and to develop a vaccine. That's part of the problem. There is no vaccine to develop to deal with this crisis. And medical supplies. In addition, $2.8 billion for the Centers for Disease Control, which is the most respected of its kind, not only in our country but around the world. $61 million for Food and Drug Administration, and $836 million for the National Institute of Health. We also, on March 18th, passed a second overwhelmingly bipartisan bill that the President signed called the Families First Coronavirus Response Act. It provides for paid sick and family leave for workers, hundreds of millions of dollars for nutrition assistance. With our schools closed now, the school breakfast and lunch program, which is very important for nutrition of our young people, we're still trying to make that available. Also to increase flexibility for delivery of food for those in need. And most urgently, providing protections for frontline medical workers. These are the physicians, the nurses, the healthcare workers who are at the front lines. Also, additional funding for testing. We still have not been able to provide the testing necessary to really determine the breadth and the length of this virus around the country. And also emergency funding cash for unemployment insurance programs. Last week, I went back to Washington and we passed the CARES Act. And among the many things it provides, over $2.2 trillion funding for unemployment insurance with an additional $600 per week on top of the state's benefit, direct payments for Americans up to $1,200 per adult and $500 per child, additional food assistance for money for food banks. Our food banks are really providing a critical need, homeowners and renters protections, funding for our veterans programs, energy assistance for low-income families, student loan relief, and relief, very importantly, for our businesses, small and large, and incentives for those businesses to try to keep their employees on the payrolls. And let me just close by saying that we're working on a fourth bill. It will be focused on a host of different areas, state and local governments that are going to be dramatically impacted with the loss of revenues because of the jobs that have been lost, clearly, and the businesses that have had to change their whole performance plan. Our schools are shut down, tremendous impact there. As a matter of fact, the President of the United States today tweeted that he thinks the fourth bill ought to provide over $2 trillion for infrastructure, investments in our water systems, our transportation systems, the kind of investments that I've been urging for years, investments that our parents and grandparents made. And with interest rates at an all-time low, I think this is a good time to consider that kind of a measure that hopefully we could act on by the end of April or early May. And of course, like all the legislation that we've passed so far, it will be overwhelmingly bipartisan because we have a Democratic House of Representatives, we have a Republican United States Senate, and we have a Republican administration. For its very nature, to pass anything successfully, it has to be overwhelmingly bipartisan. So with that said, I want you to know that we're going to still continue to work for you at all levels, not only on this crisis, but everything else that I'm engaged in, from our health and education to water and transportation and our agriculture economy. So let's hear now from our local experts. First, I'd like to introduce Dr. Rais Vohra, Interim Health Officer from Fresno County. He's been working very hard. We've been in regular communication as he's attempting to try to deal with our host of challenges that we face here, not only in Fresno County, but the neighboring counties as well. Dr. Vohra, would you please introduce yourself?
Thank you so much, Congressman. It's a real honor to be able to spend some time with you and your callers and really just talk about my role, and hopefully I can also share some of the challenges and next steps that we're taking here at the level of Fresno County and really throughout the region of the Central Valley. So as the Interim Health Officer, my specific role, as I see it, is just to try to educate, inform, support, and connect. And really that involves interacting with the general public and also with our medical providers and our medical community and also the staff at my public health department as we interface with our state and federal partners. So that's been obviously a real learning curve, just because everything is escalated and accelerated to such a degree worldwide and even here in California. I can tell you that as of now, we have approximately 53 cases. New cases are coming in every day, so the number keeps ticking up. But we have 53 cases in Fresno County. That's right, and I know we have some other doctors from the rest of the Central Valley on as well. Throughout the Central Valley, we have approximately 100 to 150 cases just among the 7-county region. And many of those are related to community spread, which is the phase that is really difficult for us to control. And that's kind of what we are starting to see here in the last week with our cases that are coming into our medical providers and getting tested. As you said, I totally want to echo what you said, which is that we're not doing enough testing. That's been a real frustration for us. We're trying to select the people that will benefit from this testing the most, meaning those that are very vulnerable and have a high risk of having complications, and also those that are on the front lines of our workforce, our first responders, our law enforcement agencies, and those who are doing public service, because we know that those essential functions have to be maintained, and we want to make sure that that workforce stays healthy because they really don't have the option to not come to work. So we're trying to support those communities as much as we can. Obviously, the science on this disease is changing very quickly. We're coming up with new ways of thinking about it, new facts that we know about this virus, how it lives, how it gets transmitted, and we're responding to that with some of the ways that we are actually doing our medical practices. Very early on, I think that we adopted social distancing measures, and that included really closing a lot of schools and gatherings. And really our message has been every single day to remind people and to encourage people to just maintain their distance from each other, because that we know will help slow the spread of this contagion from person to person. More recently, what my county did and what several other counties here in the Central Valley did was to pass a series of local health officer orders that are all based on the concept of febrile respiratory illness. So we know that because we're challenged by the testing and the test results, we don't really want to act on just the positive lab results. We actually want to act as soon as possible whenever somebody develops a fever and a respiratory illness. And we want to go even days ahead of the test in that sense. And so our health officer orders are in place now to help employers, to help hospitals, to help medical providers really screen out people that could have the COVID and get them the help that they need in order to do the quarantine and the self-isolation as early as possible. So those are some of the things that we're working on now. In terms of the challenges and next steps, I think we have to absolutely keep our eye on the ball when it comes to supply lines. And that means big and small, things like masks, which are just kind of disposable and throwaway items, and that we took for granted for a while, are now very valuable. And so we're watching every single mask and how it's being used, and we're urging every single one of our partners to make sure that they're conserving as much as possible all of those items. And then we're also looking at the supply lines for bigger items like ventilators and oxygen tanks and dialysis machines and things like this, because we know that if we go from the contingency mode that we're in now into the crisis mode that we certainly could be in the future, then we're really going to have to think hard about the resource allocation piece of this crisis. So those are the kinds of things that I'm actively working on, and I'm happy to answer any questions from your callers about any of those topics.
Well, we appreciate that, Doctor, and we're also pleased to have Dr. Rebecca Nanyonjo Kemp. She is the Director of Public Health for Merced County, and she and I have been in communication, and we appreciate the good work you're doing. And Dr. Kemp, would you please like to make a few comments?
Yes, hi, good afternoon, and thank you for the invitation, having us in this Tele-Town hall. I agree with everything Dr. Vohra has stated. We've been working actually from a collaborative approach with more than one county, trying to direct our resources here in the San Joaquin Valley to identifying where our gaps exist, so we're prepared in the event of a surge. And to speak to Dr. Vohra's statement, there are approximately 150 or so cases. Here specific to Merced County, we haven't seen as wide a spread. We do have a more broadly placed community in terms of not having that same population density you would see in other areas that have large populations, small amount of acreage to accommodate. We're trying to capitalize on that from a preventative measures perspective in ensuring that people exercise those simple effective measures of social distancing, respiratory etiquette, making sure that, especially in a community such as this where there is a large amount of diversity and there's a large amount of monolingual inhabitants, that they understand when you stay at home with your family, that doesn't include every member of your family from, third line down, fourth line down. Here locally, some of the efforts that we've engaged in, we activated our Departmental Operations Center on January 27th. This is long before we even saw it start really spreading into the United States. That being said, we wanted to be prepared from a response perspective and really exercise some of our incident command structure from a public health perspective. And so since January 27th, we have been activated, clearly more activated now as the situation continues to gain momentum. We have been working with several of our partners, the Office of the Sheriff being one of the primary partners in ensuring enforcement and compliance from a stay-at-home, non-essential versus essential business service perspective. Every week within this county, we try and we actually open it up as much as possible because we realize that some of our different sectors may not have the same outlets for communication, but each morning we've been doing our best to liaise with our pre-hospital or our emergency responders on one conference call, and then our educational leaders on a different conference call, and then our healthcare professionals being able to engage them on a separate conference call, and certainly not least having our daily conversations with our Emergency Operations Center. Within the county here in Merced County, we do have 10 cases, of which one has been identified as community spread, the other is really unknown. However, it'd be foolhardy to not recognize the impact that our surrounding communities play to the numbers that we see here. We know that the spread of disease moves as quickly as the transit does, and while there are a lot of shelter-at-home, shelter-in-place orders that have come down from the statewide government, if you are driving along the 99 corridor, you'll see there's actually quite a lot of movement that remains in our contiguous counties and inevitably would impact us one way or another. With respect to our modeling, we do recognize here in the San Joaquin Valley that we are not going to have the resources that are required in the event of surge capacity. There were several models that were distributed at the state and federal levels to identify if what you have is what you would need in the event that, a certain percentage of your population were impacted. With the governor stating that, there is a high expectation, a high percentage, greater than 50%, 56% of every resident that lives in the state of California, social contact, social distancing, those preventative measures, even though they're simple and free, one thing we do know, whether you look at the global recommendations or our sister states who've been impacted by this same issue, is that these preventative measures are actually what the most effective measures are. And so we have really been hammering this home. We have a lot of partnerships that have taken place or currently in place with our law enforcement agencies, not necessarily from a criminal or punitive perspective, but ensuring that people do understand the severity of this. From China to where we are now in the United States, the paradigm has shifted in terms of people who are impacted. We were told not that long ago that it was only people who were above the age of 65 who were the most vulnerable. Well, certainly not in this community, and I'm sure in the surrounding communities have they seen that portrait be aligned. Now, there may be higher rates of mortality, but we are seeing people who may not have those same underlying conditions we were told being significantly impacted. We have done our best throughout the Central Valley to remain not just in contact with one another, but yourself, Congressman Costa, as well as other politicians being able to advocate on our behalf. We are starting to see things come down the pipeline through the state health offices that show where resources are going to be allocated. And time again, we see the San Joaquin Valley not being prioritized necessarily. I think of these makeshift hospitals that they just distributed where they would be landing spots throughout the state. The San Joaquin Valley was not included in that. I think the closest one was in Contra Costa County. So from the perspective, I'm sorry?
Yeah, I'm sorry, Doctor. We've actually got the administration to agree on locating one in Fresno. We're still working on the site as it relates to that. But we really appreciate all of your efforts. And I think the point that you make and that the other is that we're in uncharted waters. This is unparalleled. And so as we cobbled together a strategy in which there's no vaccine for this virus, we're preparing for the worst and hoping it doesn't happen. But I think to be responsible, we have to prepare for the worst. And you've done a terrific job with your cohorts.
Thank you for that, and we do appreciate the support. And, I'll end it on the note of preventative measures do work best, but also these partnerships that we've established with Fresno County, Madera County, Mariposa, and the surrounding San Joaquin Valley counties is what's going to make the difference in terms of having the immediate or timely responses that we'd like to have in place versus depending on a resource that may not be available to us in time. So on that note, I'll conclude my comments there, and again want to express my sincere appreciation for including us on this Tele-Town hall. Thank you.
We'll look forward to the questions now.
All right, Congressman. Our first question is about stimulus check and eligibility for one, and it looks like we've got Henri on the line. Go ahead with your question, please.
Yes, Congressman, my question is about the CARE stimulus that just came out. I started working in December of 2019, and so I hadn't filed taxes prior to that. Is that all I need to do is file for December to be able to be eligible for the stimulus check, do you know?
Well, yes, you're eligible, Henry, and even if you worked only 1 month last year and you're still filing your taxes, as you indicated, for the direct payments, and that would include even if you were on Social Security or disability, you're eligible for a direct payment. The definitions under the direct payments are individuals making up to $75,000, and of course it would be double that amount for a married couple that are both working, up to $1,200 with an additional $500 if you have a minor child. And these payments would be issued by the IRS via a direct deposit or check, and it would be based either on the 2019 or 2018 return or your 2019 Social Security statement. And if you haven't filed a tax return in 2018 or 2019 and you've not received Social Security benefits, the IRS recommends filing a 2018 return to receive payment. And if the IRS does not have the taxpayer's bank account information, you should look, Henry, at providing a letter to the IRS and detail how you can receive the payment. None of these payments are taxable, and they're not subject to any garnishment either. And we hope the intention is that they get out within the next few weeks. But I just got off a conference call this morning, and with all of our efforts here in the last month, the 3 bills that I noted earlier, the IRS and the Small Business Administration, they're all backlogged in terms of their efforts to get this incredible response back, this stimulus package, and to provide the safety net to people like yourself. If you have a problem with this, Henry, call our office in Merced, and we'll certainly try to help you follow up.
All right. Moving forward, next on the line we've got Herman, and Herman's thinking about masks, and has anything changed in what we know about the airborne nature of this virus? Go ahead, Herman, with your question.
Hi. Basically, I've noticed that there may be another directive as far as the use of masks. Before, it was just using it if you had the disease or if you were caring for someone with the disease. And now I'm hearing maybe a mask should be worn all the time. Can you clarify this?
Sure. Thanks, Herman. That's a great question. That's actually the most important question, I think, that we could be addressing from the public health standpoint today. And the reason that I say that is because so much is being learned about this virus. At first, the Centers for Disease Control and Prevention and the World Health Organization really wanted everyone to have what's called airborne precautions, meaning that everyone needs to have the N95 masks, et cetera. And then slowly, the thought on this has evolved to where we know that this virus is passed on through droplets, so that just being close to someone that has the disease is really the big risk factor there. And those droplets travel, up to 6 feet, which is where that 6 foot distance comes from, is, if you could just stay 6 feet away from someone else, then you're probably not in their airspace and you're not going to just catch the bug just by being in the same room with them or something like that. So that's why we say, always keep that 6 foot distance no matter what at all times. Now, there's times when you just can't keep that 6 foot distance, especially in our healthcare workforce who have to interact with patients, get their vital signs, do their physical exam, maybe do some procedures on them. So that's when the masking becomes really important. And you are absolutely right that the thinking on this has changed. We know that the different types of masks are good for different types of procedures. We know that our healthcare workers that are going to be exposed to really the high-risk procedures, like when someone needs to get intubated and put it on a ventilator or something like that. Those are high-risk procedures, and those are where the N95 masks are still necessary. For everyone else in healthcare, and really for even our patients, what we're recommending is a surgical mask, which are going to protect you from the droplets as those are coming out of people, et cetera. More recently, however, you probably noticed that there's a lot of community groups that are creating their own masks. And those are generally cloth masks, and there's different kinds of fabrics, but those are basically considered a lower level of protection than either the N95 mask or the surgical masks. And that's where the medical agencies and the Centers for Disease Control are really thinking hard about how to incorporate those cloth masks into some of the directives. So that's probably why you're asking that question about whether the directives have changed. For now, what we're recommending is if you're in the healthcare workforce, definitely use a surgical mask or better, meaning an N95 mask or some other respirator. If you're a patient that actually has the COVID, then basically you need to be using either a surgical mask or just staying in your house at all times and not interacting with other people at all. And then with the cloth mask, that's something where if someone wants to wear that just for an extra layer of protection, like, for example, if they're out doing their grocery shopping or if they're out at the park, just to make absolutely sure that they have that extra layer of protection, either because they think they might catch something or because they might have a virus and that they don't want to pass it on to someone else, then that's where that cloth mask might be an extra layer of protection. And now that we have access to a bunch of cloth masks, I think we are going to see some recommendations about how to use those best. Again, they're not going to replace the medical masks that we know work really well, but for general interactions and general non-medical settings, then I think cloth masks are something that make more and more sense just to, again, create one more barrier between people so that they're not passing the droplets back and forth.
Thank you very much, Doctor. Moving forward, here comes another health question. We've got Janet on the line with an elderly father-in-law who doesn't want to socially distance himself. Go ahead, Janet, with your question, please.
Hi. Thank you so much, Congressman, for having this town hall, by the way.
You're welcome.
I'm caring for my elderly father-in-law. My husband is an essential worker, and so he has his own apartment in an over 55 complex. He has a healthcare worker that comes in once a week to do his grocery shopping and help him with cleaning. And my husband and I also will take him things that he needs when he asks for them. I've set up a Grubhub account, so if he wants some restaurant food, that gets delivered. But he still wants to go out in the public. What do I say to him to make him understand that he's not only putting himself at risk, but the rest of the community?
Well, for those of us who've been caregivers with our parents or involved with our grandparents, it's a challenge. Let's just be clear about that. But this pandemic is like no challenge that we have ever faced in our country. We had the flu crisis over 100 years ago, but in modern history, we have not faced a crisis, a healthcare crisis like this without a vaccine. And I don't know what age he may be in. Sometimes, when you get older like that, you kind of figure, you've lived your life and you're going to live it the way you want to. But it's not fair, and he needs to understand, and I'll maybe let Rebecca comment that we all have a role to play. We're all in this together, and we have to be supportive of one another. And so his role in part, as difficult as it may be, is to maybe engage in whatever hobby he may have, or reading or other means. Or I'm talking to people at night on Skype and on phones to my family, because I have to be separated, as we all do. Rebecca, you care to comment?
Yes, hi, good afternoon, Congressman. So I have the pleasure of having our interim health officer just walking into the office, Dr. Ken Bird, and to respond to the lady's question regarding how to message or frame having her elderly father socially distanced. I assume that he is already aware that there is a significant increase in terms of the vulnerability of really having an adverse outcome if within that age group the over 65 or 65 years of age and above do acquire COVID-19. I don't know what type of setting the individual is placed in, but I can state that we have started to see in our facilities or our communities where it's a 55-plus community that there have been some adverse outcomes, people hospitalized. The one thing I would want to encourage you to remember is that the ventilation and some of the equipment that we require here in the event of hospitalizations or otherwise just as a source of life are already being tapped out. Should there be an adverse outcome because somebody didn't do those simple preventative measures such as washing hands, exercising, respiratory etiquette, and especially socially distancing, the Centers for Medicaid and Medicare Services have already put a moratorium or placed a stop on people visiting facilities where they know that people are higher risk, and that does include the older population. So the only thing I can advise of is really hammering the message home about the importance of these preventative measures and just as I alluded to in the opening, that social distancing, whether you're looking abroad or you're looking nationally at what the best recommendations are from mayors and governors, is to exercise appropriate social distancing and hand washing and respiratory etiquette. Those are the most important things, and I would say at highest level is social distancing. That is singly the most effective in being able to combat this and to flatten or blunt that curve a bit more.
Thank you very much, Doctor. Next on the line, we've got Petra. Petra, go ahead with your unemployment benefits question for Congressman Costa.
Hello, Congressman Costa. Thank you again for having us, for listening to us and our concerns. My concern is about the unemployment benefits. I'm a substitute teacher, and Friday the 13th was my last day of work, and I am a little nervous about the income. My husband is working, and he's an essential worker. He works for a landfill. He's a mechanic. Will we be receiving those? I can't even get onto the unemployment benefits line.
Well, that's a problem, Petra, and we and afterwards, if you want to call our office, we'll try to help you. But yes, the short answer is you are if you've lost your job because the schools have shut down. In your case, you can immediately sign up for unemployment insurance. Now, getting online to do that has been challenging because in some cases, certain times of day, the system has crashed. But it's administered by the state of California. It's the easiest way to sign up and manage your benefits is through the California Employment Development Department website. If you haven't visited there, you should. The website is www.edd.ca.gov unemployment. And the CARE Act adds up to an additional $600 per week to your benefit now through July 21st. That means if you've received a maximum California unemployment benefit of $450 per week, you'd receive a weekly total of $1,050 to help carry on. And the CARES Act also temporarily expands unemployment insurance to cover individuals who are not traditionally covered. This includes people that are self-employed, gig workers in this high-tech world we live in, people who like Uber drivers, ride shares, independent contractors like realtors and hairstylists, workers who have an irregular work history. We also expanded the eligibility to go in place through the end of this year. There is no waiting period, so if you are unemployed, go to the state's website, apply now. If you don't have access to the internet and you'd prefer to call or dial in, and again, a lot of people are calling in, so it's a challenge, but the number, if you want to take this down slowly, is 1-800-300-5616, and for those Spanish speakers who are listening, you can dial 1-800-326-8937. So please, Patrick, stay with it. If you're not able to get filed here in the next 24 hours, please call our office in Fresno at 495-1620, and we'll help you. Okay?
Thank you very much, Representative. Moving on, we've got Diane on the line, and this looks like a question for our public health officials, and it's about the virus. Go ahead, Diane, with your question, please.
Yes, it's kind of a multifaceted one. If you acquire the virus, is there a passive immunity after you heal from getting it again?
Dr. Vohra?
Yes. So I think we're definitely looking at immunological reactions and how people are going to recover. And I think that's really going to be the next phase is, obviously we don't want anyone to get this virus, but because it's happening, we can now actually start to study the people that are recovering from it and seeing how their immune system's recovered, so that can teach us about, new treatments. Some of those new treatments that we've all, I think, already heard about is actually using serum from convalescent patients, that means recovered patients, and actually transfusing other patients who might need that serum, but also just learning more about how the immune system responds to this virus so that we can actually target all of those different biological reactions and hopefully shut down the complications from this virus before they even start. So yeah, that's moving quickly, and I wish that there was a drug that's ready in the pipeline in the FDA to deploy right now, but unfortunately we're not there yet. But I know that people are actively researching the immunology of this virus in order to try to find some treatments.
Thank you, Doctor. Moving forward, we've got Robert on the line, and Robert's looking for a little bit of information about essential employees. Go ahead with your question, Robert.
Hi, I actually work in Merced County, and I actually have a two-part question. Let me ask this other one first. I work at the county building downtown, and I'm just wondering if I'm being a little too paranoid, not wanting to go into work, and is it safe as long as I wash my hands all the time and we keep social distancing. I mean, I know it's closed to the public as of right now. So I just looking for a little reassurance since I do have to go in and go to work. And second part of that, the statement that was given out said that essential and non-essential personnel would be weeded out by the departments, and I just wondered if that had been done yet. And if so, has the workforce been reduced? And that's it.
Dr. Kemp, maybe you might respond, being from Merced County and the coordination you're doing with your colleagues.
Yes, hi, good afternoon, Robert. So I happen to be downtown. I've actually been downtown quite a few times. They are putting in measures with respect to social distancing for what they can control. I've seen that there's a presence of hand sanitizers. Essentially having the doors closed to the public except for essential work staff does significantly reduce the amount or the probability of having spread, because you don't have throws of people walking in and out of the building. With respect to essential versus non-essential employees, yes, we have been working with the county executive office in identifying where essential and non-essential services would land. Some of these are at the departmental level, so it's really at the discretion of the county executive office as well as some of the department heads in terms of how they interpret some of those codes and requirements. If you take a look at the governor's order, you'll see that actually there's quite a few disciplines that are considered essential services. And so there are some individuals who are working from home. There's some things that are going to come down the pipeline from the county perspective that are going to encourage, where we can, having individuals work from home. But honestly, we're serving just as a technical assistance more so to the county executive office, rather than dictating who and what classification of employees would be required to work. And I, as a department head, can also attest to the fact that I'll have to be looking within my own department to identify how we're going to move this forward. And I hope that answers your question.
Thank you, Doctor. Next on the line, we've got a small business owner named Lee. Lee, you're live with Congressman Costa. Go right ahead, please.
Hello, Congressman Costa. Actually, I'm calling on behalf of my son. He has a small business with 3 employees. I was wondering if there's a website or place he can get more specific information about how the stimulus package will assist him as a small employer.
Well, thank you, Lee, and please tell your son, one of the things that we worked on very hard last week in putting this stimulus package together was to try to focus on businesses in America that, as a result of this pandemic, would either have to dramatically reduce their operations or in some cases close. And the small business provision provides incentives for those small businesses to keep employees on the payroll for much needed efforts to keep the economy going. The CARES Act creates a strong paycheck protection program. What that means is that small businesses have an incentive to keep employees on the payroll. The legislation that the President signed into law offers extensive debt relief for small businesses, up to $350 billion in total, with individual forgivable loans up to $10 million per business. The Small Business Administration is also required to enact these programs within regulations no later than 15 days after the act signed into law. The President signed into law last Friday. So they're currently in the process of gearing up. Have your son, and write this down, he can go online to sba.gov/coronavirus. That's sba.gov/coronavirus. Now, let me tell you, I was in a conference call earlier this morning, and we've been getting calls from our own office. And because the President, we just passed this last week, and the President signed it into law on Friday, SBA is overwhelmed right now. And they're trying to handle the calls and the emails that they're getting for the applications of these loans, and many of them are forgivable grants. But the fact of the matter is and we're trying to work with banks that in some cases have not had a history, community banks in particular, maybe of working with the Small Business Administration, the SBA. And so we're trying to get this up and running. And so if your son's not able to successfully get a hold of the SBA or to log on for his application, his request, please call our office in Merced. But this is going to take a while because they're just backlogged and they're inundated. And so I think we have to just continue to work on it. And based on the conversations I had this morning, I think we need to get them additional staff, some way to expedite these, because we got a lot of small businesses in this country that are trying to stay open and trying to keep their employees working. And these loans are critical to that effort.
Thank you, Congressman. Next up, we've got Jose and a question about kids in the school year. Go ahead, Jose, with your question, please.
Hi, good afternoon. Thank you for taking my question. Based on the current modeling, is it looking like schools may remain closed for the rest of the school year?
Well, Jose, my sense is that that's going to probably be the case. As our health experts have said in the answers to previous questions, we're learning more and more about how we best strategize to protect America's health and safety. I thought it was always wishful thinking that the president somehow thought on Easter Sunday we were somehow going to all come back the next day. Yesterday he indicated that the federal guidelines would stay in place till April 30th. As I'm talking to our school administrators at K through 12 and our community colleges and our higher education, I think they're reluctantly feeling that really the school year, for all practical purposes, is going to be very difficult to re-engage by May or June when normally it would be finished anyway. And I think we're trying to figure out how we deal with hopefully maybe summer school, but that is in question as well, and more likely starting in the fall, assuming that we are able to do, under the best circumstances, get the control of this pandemic. But I don't think it's likely to see the rest of in April and May the school year re-emerging.
Can I just share something, Congressman?
Yes.
Just to dovetail on your comments, we talk to our schools all the time. Even though our schools are quote unquote closed, they like to tell us that the buildings are closed but schools open, meaning that they are fully dedicated to continuing the education of their students through online and other types of learning. So that's to me very heartening, and I hope that if there's anything positive that we take out of this pandemic, it's how we really can stay connected using the technology that we have available, and hopefully getting that technology more broadly distributed to really everyone in our society. But second of all, some of the schools that we have here in the Fresno area actually have some really interesting technology programs, including 3D printing. And so several of the high school groups have actually started up 3D printing medical supplies for us because they know that we're short. So they're actually printing masks and face shields as part of their small group activities. And obviously they're keeping all of their social distance while they're doing it. But some of them have actually gotten to work to actually help address this pandemic. So I just wanted to really congratulate and say thank you to these high school students that are taking a part in this fight. It's very heartening to see, and it gives me hope.
Well, and it gives me hope too as well, Doctor. Part of the challenge, though, in my congressional district, 15% of my rural areas don't have access to the internet. And then when you look at the the challenges with poverty and lower income folks. A lot of them don't have iPads or desktop computers. President Castro at Fresno State and some of our school administrators have talked about maybe in this next package where we might try to provide some funding for that type of remote distant learning that, as you indicated, is available for many of our students.
Yes.
There are parts of our valley where that's just not possible.
Yeah.
Thank you very much, gentlemen. Moving forward, we've got Carolyn, and her question has something to do about coronavirus reporting. Go ahead with your question, Carolyn. Hello, Carolyn. Are you there?
Yes, I'm here. Yes,
Go ahead
I'm
with
here.
your question. You're live on the call.
My question is when the county reports the number of cases within the county, why aren't they more specific about the towns? Because if somebody lives in Atwater and say Atwater has more or less cases than Merced, people might want to prefer to drive to the lower risk area just to buy groceries. So my question is, why aren't they reporting it by city?
Did you get
I think
that
that's a question for our healthcare experts.
Yes,
Dr. Kemp, Dr. Vohra.
Good afternoon, and I know what she's referring to because those cities are in the county of Merced. The reason that we don't share information with respect to the cities where cases are located by demographics is because we have a very low amount of cases here. And so there's been a deliberateness, or it's done purposefully so people cannot identify individuals who may be impacted. And even though it seems like, well, nobody can identify if you say it by city and age demographic, male or female, we have had people figure it out before. We want to be mindful of the fact that we don't have that many cases to report, so any little bit could lead to suspicion or identification, and the health officer has issued that directive that he wants to keep it as broad as possible. When we reach a certain amount of cases where there's a little less likelihood of people being able to guess who might be impacted, then we'll start to make that information available. And we do recognize that each county posts their information differently, but at where we are, being in a very small community, that's about as comfortable as we are for the time being.
Thank you very much, Doctor. Next up on the line, we have Monica with a question about the unhoused. Go ahead, Monica, with your question, please.
Yes, thank you, Congressman Costa. I have met you before, sir. I am a homeless advocate in Merced and actually homeless myself, sir. So at this time and point, I know people that are housed and just heard that you're making sure there's a spiel on people within Merced County that are not coming out of home. So I'm wondering, sir, what you're going to do to help us out here that we're on the street.
Well, thank you, Monica. It's a good question. And even before this pandemic came to us, we know that the homeless crisis in our state and in our country has been a real challenge. Governor Newsom and I and others have worked for the state to bring together a very significant effort before this healthcare crisis to address the homelessness. But under the CARES Act that we passed last week and the President signed, it will provide an additional level of billions of dollars to help homeless folks throughout the country. It provides $4 billion for emergency solution grants to support additional homeless assistance, prevention, and prevent eviction issues, which will couple on the existing program that the governor and those of us who have supported that effort were putting in place back in January. It provides prevention of eviction activities, including rapid rehousing and housing counseling and rental deposit assistance, which will mitigate the adverse impacts of this pandemic on working families. It provides almost $2 billion for public housing agencies to keep over 3.2 million Section 8 vouchers in that housing stock. Of course, part of the problem, as you know, is that we don't have enough housing stock. $1 billion to allow for continuation of housing assistance contracts with private landlords who do have some housing available, and $65 million for elderly persons and those with disability for rental assistance. It provides support for service coordinators and support services for more than 114,000 affordable households for elderly and over 30,000 affordable households for low-income persons with disabilities. And of course, that's a real challenge with many of those who are homeless, is that they're disabled. And then it also provides additional funding for expanded efforts for opportunities with persons who have aids in order to maintain their rental housing. So that's an important part of what we're trying to do. But obviously, this is evolving, and it's something that I think is very critical. And I thank you for raising the issue. And I'm telling you, we know it's got to be a part of our overall efforts for sure.
Thank you, Congressman. I'm being told that we need to begin to wrap up the call, that we're running out of time. We have time for one more question. And on the line next, we have Mary, who's got a question about personal protective equipment. Go ahead, Mary, with your question.
Yes, I have a question about CRMC being a level 1 trauma center. We're hearing that they're in critical need of PPEs and masks, and I'm wondering how that is being addressed.
Well,
sure, I'll take that.
Mary, I'm glad you
Go
raised
ahead,
that, because it's one of the questions that I've continued to ask our hospitals here in the Valley, and it's one of the efforts that we've been continuing to work on. Yesterday was National Physicians Day around the country, and when we think of these men and women, the doctors, the nurses, the healthcare workers, all of these who are at the front lines every day at great exposure and risk to themselves, not to mention their families, they must have the personal protective equipment necessary and the medical supplies to be there at the front lines to deal with this pandemic. And sadly, we have been slow to respond. The administration yesterday informed us that they've created the Supply Chain Stabilization Task Force headed by Rear Admiral John Pulaski, and he's trying to identify medical supplies and personal protective equipment needs in the United States, and that's just doing an inventory. We've been doing this for the last 2 weeks here with Valley Community Medical Center, reaching out to Valley Veterans Hospital, Valley Children's, Madera Community Medical Center, Mercy Hospital, Los Banos Memorial, as well as St. Agnes, and our clinics. And this continues to be among the highest of the needs that they have, trying to get an inventory. We know that the task force is trying to distribute the PPE, the gloves, the gowns, the hand sanitizers, and the surgical masks, and they're focusing on receiving supplies from throughout the country, wherever they can get it, and we're reaching out. The White House indicated that they've developed a partnership with McKesson Corporation, Cardinal, Owens & Minor, and other companies to expedite efforts. There's been a first of 22 air shipments of supplies from Project Airbridge, reportedly arriving from New York, where the most critical hotspot is today, from China. This weekend there's going to be over 130,000 N95 masks, 1.8 million face masks, gowns, 10 million gloves, and thousands of thermometers that will be distributed in the New York, New Jersey, and Connecticut area. When I get off this phone call, Mary, I'm going to be in a conference call with all of those hospitals I noted and the healthcare clinics, getting an update on their inventory needs. But the fact is, as you pointed out, we're short. We're short in supply here for the hospitals here in our area for the personal protective equipment, and we absolutely must change that. And I'm doing everything I possibly can to ensure that our local healthcare providers have that, and that our physicians, our nurses, our healthcare workers have the necessary protection so that they can do their job at great risk. So I'm glad that you raised the issue, and but the reality is that many of us who argued a month ago that we were behind the game on this one sadly have proven to be true, as this epidemic has spread across the country. And the tests, as an example, we're still short of tests. Our county healthcare officers who are on the phone here will tell you of their frustration in trying to get additional tests to determine not only how far this pandemic has spread here in the Valley, but also for our healthcare workers and for our first responders, those, whether they be people who are on emergency services or our police or fire, and so consequently, we've got to get more tests out there. We've been told this morning in a conference call that we won't have, when the president says anybody who wants a test will have a test, that's simply not true. We're told that we will not have tests for everybody who needs this in this country until probably the end of May or June. So now the situation is, if you show the symptoms, if you have a doctor, a physician that requests that you get a test, or a healthcare facility, those are the ways in which you can get a test. But not everybody in America who simply wants to, if you feel healthy and normal, want a test are able to get one. And so we got to do better.
Thank you very much, Congressman. As I mentioned, we need to begin to bring to a close this call. So do you have any closing thoughts?
Yes, I do. I want to thank all of you who've taken the time out of your day, although with this social distancing and stay-at-home order by the president and by Governor Newsom and others, I suspect many of you are at home today, and normally you might be at work. But this telephonic town hall is one of the ways that we can communicate and we can have a conversation and answer questions with experts like Dr. Kemp and Dr. Vohra, who I want to thank for the good work they're doing daily. They're at the front lines with so many of our healthcare providers who are trying to protect all of us. And so their experience and their expertise is really critical. And I want to once again thank them for their efforts in dealing with a response and an overall strategy, short-term and long-term, on COVID-19, otherwise known as the coronavirus. Let me just finally say that I am confident in the American people. Certainly we are being tested. Certainly these are uncertain times. But we know that when America has been tested in the past through difficult times, through recessions, through wars, through depressions, that when we come together, there's no challenge that we cannot successfully overcome. And I believe if we work together, we will stop this virus from spreading. But we remember the comments that were made by our two friends here today: washing your hands, making sure that you protect yourselves, using hand sanitizer, keeping your distance. Just good common sense practices are critical to stopping the spread of this virus. And once again, I want to thank all of our healthcare workers and other essential workers who are deemed at providing. I mean, these are people like working in our grocery stores and doing other essential services. To thank them for putting themselves in harm's way. as we fight this epidemic that is spreading around the world and spreading around our country. Together, I know that we will be successful, but it's not going to happen overnight. This is going to take months to overcome in terms of America's health and safety, as well as the social and economic impacts that I believe are going to be felt throughout this year, no matter even under our best efforts. So we're all in this together. If we can be of any help, our offices are still operating, even though we're doing it remotely through telephones and computers. Don't hesitate to call our offices in Merced and in Fresno, and we look forward to continuing to work with you, and we will have future telephonic town halls. Again, thank you. Let's be together. As Americans, we know that the bonds that we share in common are far, far stronger than whatever differences we may have. Thank you for allowing me to serve as your representative in our nation's capital.
A hearty thanks is definitely in order for everyone who took the time to join us for this important telephone town hall. We appreciate the opportunity to answer your questions. To contact Congressman Costa's office, please call 202-225-3341 or visit our website at costa.house.gov. Now, if you need
and our
specific
Fresno
help,
office number is 559-495-1620. Sorry, Derek, we have two offices.
Yes, sir. Thank you very much for that clarification. Now, if you need specific help from our district office, please log on to our website at costa.house.gov/COVID-19-help to submit a request, and one of our case workers will be in touch with you. We certainly will host more of these events in the future to keep you informed on what the Congressman is working on, as well as available resources and other important updates on the coronavirus. Thank you again for participating in this call. We hope you stay healthy and safe and have a wonderful day.